The periodontium exists in three basic states: health, gingivitis, and periodontitis. It is important to recognize the differences among health, gingivitis, and periodontitis. Gingivitis and periodontitis are the two basic categories of periodontal disease. In health, the periodontium is an intricate system of tissues that surrounds and supports the teeth. In health, the periodontium exhibits the following characteristics: a junctional epithelium that is coronal to the cemento-enamel junction. Intact, healthy supragingival fiber bundles that provide support to the gingiva. Intact periodontal ligament fibers that attach the root to the bone of the tooth socket. Intact, healthy alveolar bone that supports and protects the roots of the teeth. Gingivitis is a bacterial infection that is confined to the gingiva. The tissue damage that occurs in gingivitis results in reversible damage to the tissues of the periodontium. Gingivitis is a type of periodontal disease characterized by changes in the color, contour, and consistency of the gingival tissues. Gingival inflammation is the body's reaction to the bacterial infection of the gingival tissues by periodontal pathogens. The inflammatory response to this bacterial infection results in changes in the gingiva and the gingival connective tissue. In gingivitis, the periodontium undergoes the following changes. The junctional epithelium remains coronal to the cemento-enamel junction. However, the junctional epithelium exhibits widened intercellular junctions. Frequently, tissue enlargement due to swelling or fibrosis causes the gingival margin to cover more of the crown of the tooth. This tissue enlargement of the gingival tissue produces a gingival pocket with a probing depth greater than 3 millimeters. This increased probing depth is caused solely by enlarged gingival tissue. Microscopically, the junctional epithelium remains in its normal position, coronal to the cemento-enamel junction. The junctional epithelium extends epithelial ridges down into the connective tissue. Such extension of the epithelial ridges can occur only because destruction of the gingival fibers creates space for the growing epithelium. In the gingival connective tissue, damage occurs to the supragingival fiber bundles. In gingivitis, there are no changes to the periodontal ligament fibers or the alveolar bone. The tissue damage in gingivitis is reversible. That is, with good patient self-care, the body can repair the damage. Periodontitis is a bacterial infection that affects all parts of the periodontium, including the gingiva, periodontal ligament, bone, and cementum. Periodontitis is the result of a complex interaction between the plaque biofilm that accumulates on tooth surfaces and the body's efforts to fight this infection. Periodontitis is the #1 cause of tooth loss in adults and is particularly prevalent in smokers and those with modifying factors such as undiagnosed or poorly controlled diabetes mellitus. In addition, there are some individuals who are genetically predisposed to developing periodontitis. In periodontitis, the periodontium undergoes the following changes. The junctional epithelium is located on the cementum, apical to, or below, its normal location. Movement of the junctional epithelium apical to its normal location is termed the apical migration of the junctional epithelium. The coronal-most portion of the junctional epithelium detaches from the tooth surface. As the bacterial infection progresses, the apical portion of the junctional epithelium moves farther in an apical direction along the root surface, creating a periodontal pocket. The junctional epithelium proliferates and extends epithelial ridges into the connective tissue. The sulcular epithelium of the pocket wall thickens and extends epithelial ridges deep into the connective tissue. Small ulcerations of the pocket epithelium expose the underlying inflamed connective tissue. Changes in the gingival connective tissue are severe. Collagen destruction in the area of inflammation is almost complete. There is widespread destruction of the supragingival fiber bundles, reducing them to fiber fragments. The destruction of the periodontal ligament fiber bundles makes it easier for the junctional epithelium to migrate apically along the root surface. Epithelium grows over the root surface in areas where the fiber bundles have been destroyed. The loss of fiber attachment is permanent because the epithelium growing over the root surface prevents the reinsertion of the periodontal ligament fibers in the cementum. A periodontal pocket forms as the result of a pathologic deepening of the gingival sulcus. Pocket formation occurs as the result of the apical migration of the junctional epithelium, destruction of the periodontal ligament fibers, and destruction of alveolar bone. Probing depths are 3 millimeters or greater in depth because the junctional epithelium is attached to the root surface. There is permanent destruction of some or all of the periodontal ligament fiber bundles. There is permanent destruction of the alveolar bone that supports the teeth. Tooth mobility may be present. Cementum within the periodontal pocket is exposed to dental plaque biofilm. Periodontitis involves irreversible loss of attachment and bone. Periodontal pathogenesis is the sequence of events that occurs during the development of periodontal disease. The two types of periodontal disease are gingivitis and periodontitis. Gingivitis is a reversible condition that is characterized by changes in the color, contour, and consistency of the gingiva. There is no apical migration of the junctional epithelium or bone loss in gingivitis. Periodontitis results in some extent of permanent tissue destruction, characterized by pocket formation, destruction of the periodontal ligament fibers, and resorption of alveolar bone. The pattern of alveolar bone loss and periodontal ligament destruction depends on the pathway that the inflammatory process takes as it spreads from the gingiva into the alveolar bone. It is the destruction of periodontal ligament fibers and resorption of alveolar bone that leads to tooth mobility and the possibility of tooth loss.